Welcome to our new edition of our Brain Talks, a podcast series under the umbrella of the Brain Innovation Days organized by the European Brain Council. In today's Brain Talk, we take a closer look at a key area that was admittedly already gradually taking off these last years, but has rapidly come to the forefront thanks to the COVID-19 pandemic, and I mean telemedicine. Telemedicine is not new, of course, but innovation in the field remains crucial, and bringing tools directly to patients is still necessary. This was expedited by the pandemic as people in need of chronic care saw their treatment plans disrupted and their time with clinicians phased out. Today, we are joined by Professor Paul Boon, the President-elect of the European Academy of Neurology, to discuss this issue, what it was before and what it has become thanks to COVID-19, and the importance of innovation in neurology, particularly for diagnosis, treatment of specific conditions such as stroke or epilepsy. I will be your moderator for today, Frédéric Destrebec, the Executive Director of the European Brain Council, which is the founder of the Brain Innovation Days. So let's get started. Welcome, Professor Boon. Thank you for joining us today. And you are the president-elect of the EAN, the European Academy of Neurology, as I just mentioned. Before we get started and go deeper into the discussion, would you like to say a word as to your background and your work at EAN?
Well, thank you very much, Fred, for having me, for having invited me. It is a pleasure to work with the European Brain Council. And particularly innovation in neurology is something that is very dear to me. Just to introduce myself, I'm a neurologist. I have been working for many years at Ghent University Hospital as the chair of neurology and also as a division chair, looking over or overseeing departments that have to do with the brain, the nervous system, and the movement systems. As a matter of fact, I'm also working in Holland as a professor of neuromodulation with a particular interest in technological advances and innovations. I'm here on behalf of the European Academy of Neurology, which is the European umbrella organization. It is truly an academy for neurologists. We do represent 45,000 neurologists throughout Europe. And in that sense, trying to fulfill our mission, which is manifold, but basically it is about promoting neurology, promoting excellence in neurology, doing all kinds of advocacy activities with regard to neurology in the European space.
Yeah, and Paul, actually, you are the second representative that we are happy to welcome in the context of our Brain Talks. A few weeks ago, we had the pleasure to have Professor Deutschel, the past president of EAN, with us, who talked about the immense burden of neurological disorders in Europe and globally. And what we notice is that despite many breakthroughs in the field, the burden continues to grow. And we'd like to hear from you, how we can address this, and what would be the biggest challenge in your view that we face, but also what are the opportunities that we can foresee in the field?
Sure. Well, definitely a good starting point to steer this discussion is the increased burden. When I was a young neurologist, we thought that brain disorders were had a prevalence or a burden of disease of about 30%. With the more recent insights that have been worked on, among others by Professor Deutschel and his colleagues, it is now clear that neurological diseases on their own do represent a burden of disease of about 50%, which means, more patients really, basically, more also elderly patients, and an increased load of care. It is not only a matter of the numbers of patients, but also the people that we see in neurological departments have worse disease. The load of care is more important. That being said, another part of the equation is that neurological care or neurology in general has evolved from a rather contemplative discipline to a much more active, proactive, interventional discipline, which means that we have now many more treatable diseases and many more treatments. Just to give you an example, for the moment, at any given time, for the moment, more than 500 new drugs are under investigation for neurological disorders. 500 compounds. That's a massive number of compounds. And that, and I'm coming back to the work of Günther Dorschel and his colleagues, who also showed, apart from the increasing burden, that there is still limited resources. I mean, we simply do not have enough neurologists, and we simply do not have enough expenditure for neurological care and research and development. I mean, if I may quote another figure, which is in bad contrast really with the increasing prevalence and the burden of disease, it is how much money is being spent on neurological disorders in the European space. How much money do hospitals and third-party payers spend on neurological disorders? Well, that is far less than 50%. It is around 10 to 15%, which clearly shows us the gap. And why am I saying that? Because that's the context where innovation really plays a major role. Not only are we driven by innovation by content and by the people, but we simply have to innovate because our care model is not tenable anymore, given this enormous growth of burden and the limited resources. So that is, I think, the true context why innovation is evident. It speaks for itself in any discipline in medicine, I suppose, so also in neurology, but it is because this gap that I just pointed out, that we simply need to innovate, also in terms of what we do and what the plans and the trajectories for our patients are. Now, if I try to be a bit more, how should I say, concrete, and look at neurological innovation, what can I say? Well, I've just trying to think, out of the box here and give a couple of key points. If you talk about neurological innovation, it is driven by content mainly. And what is the content? Well, the content is that there is an increased insight and understanding of brain networks and the functionalities, leading to more therapeutic avenues. And this hopefully will lead to more timely and rational therapies. One of the major breakthroughs has been immunotherapy in some of the neurological diseases that was unexisting 10 years ago, and it is now really working itself to the forefront. Apart from immunotherapy, there is neurostimulation therapies, there is less invasive or non-invasive devices and wearables that can be used to treat, not only to treat, by the way, but also to diagnose, because I was just mentioning treatment avenues, but there's also improved diagnostic procedures, which will hopefully increase the access of many more patients to an earlier diagnosis and also decrease the diagnostic gap that still exists in many countries. Apart from better diagnosis and better treatment led or driven by a better understanding of what brain disorders are, we have to look also to patient outcomes. I mean, just taking the example of stroke. Stroke is a deadly disease, but we end up with more and more survivors. What do we do with those survivors? We need to be able to revalidate these people. We need to spend much more effort in rehabilitation efforts. Some of the innovations there are virtual reality that can help these people, and again, rehab at home, which already opens the way to telemedicine that I will elaborate on further, I believe. And a third driver towards innovation in neurology is certainly prevention. I mean, how do you prevent neurological diseases from happening? And I know this is not the primary interest of neurologists who see patients who already have a problem, but I think what we need to do is not only convincing the general public about the importance of brain disease prevention, but also the neurologist. I mean, we should train our young neurologists to, in every single disease where it is relevant, to also not only discuss diagnosis and treatment, but also preventive measures. There, the concept of brain health comes in, and I mean, we maybe should not go into much detail about brain health now, but brain health is this concept of a state where, let's say, people have a complete control of their physical and mental well-being, more than only not having a brain disease. And I think this concept is really vital in bringing preventive measures, prevention of brain disorders, much more to the central scene. And last but not least, innovation in neurology is not only driven by the content, but also by people. I mean, we are not talking about only about the neurologist and the nurses and paramedical staff and therapists and so on. But also, I think if we really are serious about innovating neurological care, I think people with a technological background should be much more collaborating with people with a biomedical background. And just to giving an example, I think in some universities, the new training programs for neuroengineers, for instance, which is basically technology-driven programs that are specifically focused at bringing together brain specialists and engineers together, and technology people, is, I think, of paramount importance to foster innovation. It was a long talk, but I mean
No,
your question was so relevant, you know.
no, but it's a great introduction because that's exactly, I think we can learn a lot and probably take a few of these threads or issues to carry on the discussion, because my immediate thought was to say, okay, this from this state of play, how do you see what we all experienced over the last year? Probably the biggest disruption at all levels with COVID-19. Obviously, in healthcare services or even in social services, it also meant a lot of disruption. How did you see that maybe the existing ways of adapting, how it came probably, and I mean here telemedicine particularly, how it basically became more and more used? Was this, like, in your experience, more regular, more easy as before? How did you see that it impacted your work, but also the experience of the patients that you are looking after? And what would be in your view, the I would say the way by which it mitigated the disruption that we faced?
Well, I can speak of personal experience. As a head of a department, I was faced beginning of last year with a nearly complete stop at the occasion of the first wave of COVID, at the complete stop of our regular activities in the clinic, in the ambulatory service, while at the same time half of my department was transferred into a COVID department, more specifically the sleep and video EEG monitoring unit for epilepsy patients, which had the format of a mid-care facility, and that was rather easily, and to my surprise, really easily and very well transformed within a couple of days from a sleep and epilepsy unit to a COVID department. Now, that being said, I mean, it's interesting to see, apart from my own experience, and to talk about a little bit about that, also what had happened in the rest of the world. I mean, there is a very interesting report from a global consultancy company, the McKinsey, who looked specifically at what telemedicine and COVID meant. And I mean, just quoting some figures from 2019, before, in the Western world, telemedicine was used by about 10% of patients occasionally before COVID. After COVID or during COVID, there was a huge leap to more than 40% use. So from less than 10 to more than 40% use. And if you asked patients, more than 70% of patients were potentially interested in using telemedical or telemedicine solutions. And from the perspective of healthcare providers, so from our side, and also can also confirm that in my own department, there was like a 50 times increase in the use of telemedicine solutions when compared to the pre-COVID times. Also, doctors in general looked more favorably to telemedicine, and were also feeling more comfortable with the telemedicine consultation, for instance. What we also saw is that not only in Belgium, but also throughout Europe and other Western countries, is that the third-party payers and the regulators were very quick in adapting remuneration for this type of services. So reimbursement was provided, mostly on a temporary basis, but that was certainly helpful in making it more readily accessible and usable, both by doctors and patients. And what we have seen is that not only just a teleconsultation was being used, but other services, telemedicine-based services, were used. Now, if those are just general thoughts and general figures, if we try to adapt that to neurology, I can easily talk about a couple of examples in specific diseases. For stroke, for instance, I mean, and this is not specifically COVID related, but still, fantastic use of telemedicine in stroke patients is, for instance, equipping the emergency department and the ambulances with video links, and high-speed video links, high-quality video links using 4G or 5G, which allow basically the neurologist who is based in the hospital to see a stroke patient as soon as the ambulance has arrived at home or in the street or wherever, and already make a more advanced diagnosis of that patient minutes or tens of minutes or maybe half an hour before the patient has arrived in the hospital. And this allows basically in the treatment or diagnostic part of a stroke patient to decrease the so-called door to needle time, rather, which is the time from the assessment of the indication for thrombolysis versus the moment when the syringe is injected into the patient and the treatment is actually administered. So this door to needle thing is really vital to increase the number of patients that can effectively be treated. And those telemedicine technologies are now readily available also in our hospital, and our first experiences with that are really, really positive. Just another example is sleep medicine. Sleep medicine, where the trend used to be that patient would be admitted in the hospital for a sleep study, for a polysomnography. Well, the number of indications for such a examination inpatient procedure has dropped since less invasive ambulatory systems are available that can be used at the home of the patient and still give reliable recordings. The recordings for the moment are not as reliable as they are in the hospital, but I mean, for less pressing indications, like secondary indications, this is certainly in place. This is in order. I think the technology need to be improved. The teaching or the education of the patients, also maybe the education of nurses that come to the home of the patient or technicians that come to the home of the patient to check the quality of the recording can be improved. But I think in the long term, it will show, I'm quite sure about it, that the world of polysomnography in the hospital and the scene will change completely. So that's another application of potential telemedicine use. A last example that I had in mind is one that I use every day. It is about monitoring epilepsy patients. Epilepsy patients those patients who have drug-resistant epilepsy and frequent seizures, despite adequate treatment, are still now routinely admitted in the hospital They will undergo a costly, also a time-consuming examination in the hospital. Some of these patients remain in the hospital in the monitoring unit for a week, or even if they have invasive recordings, this can be a couple of weeks. This is extremely costly. This is very time consuming. I think the future avenue there is that, again, in very specific indications, some of these monitoring sessions can be done at home, and the EEG will be fed through platforms, software platforms, to the hospital and to the neurologists or the technicians who look at this. In epilepsy, there is a particular possibility or particular opportunity that is not only recording habitual seizures with video, but also detecting the seizures by patients wearing a very non-obtrusive wearable device that notifies them or their surroundings or their caregivers of an ongoing or an upcoming seizure. So the whole business of seizure detection that is now troublesome, that is not very reliable, can certainly be upgraded by adequate technological advances. So in a nutshell, and again, it was a bit of a big nutshell, but if you apply telemedicine solutions to neurology, stroke, sleep, and epilepsy are very prominent examples of what telemedicine could do in the future.
But as you said, the technology exists and can always be improved. But I would say we know, we sometimes hear people say, okay, technology is no longer the issue. It's more, let's say, the adoption that takes time, and let's say the change to the culture, or the change to the, I would say, the chain of the health service as a whole, that then needs to adapt. Would you say that with COVID-19 we had a boost of, let's say, the adoption of these new technologies? And would you see, let's say, additional barriers that we still need to address in, let's say, this acceptance to new technologies that
Well, I
sometimes take
guess
time?
I'm sure that the COVID crisis and the different waves boosted the use, also the level of acceptability, the feasibility of some of the telemedicine solutions for sure. I also already mentioned the rather positive attitude of the reimbursement agencies and the regulators with regard to this. But I mean, if I just look at the Belgian example, they did an effort to rapidly reimbursing a telephone consultation, but the reimbursement rate is so low that, I mean, it's not a very attractive situation. So I mean, in order to make this more sustainable and make teleconsultations really a part and an generally accepted part, both by physicians and patients, of a care path, I think we need to do a more thorough job and define criteria for what such a consultation should be and what the price or the reimbursement rate should be. So more work is to be done, but I mean, for sure, COVID I'm sure it is going to accelerate this whole change of policy and change of landscape. Now, you mentioned already some concerns, and I mean, it is also sure that apart from all the opportunities that we have seen during COVID with opportunities of telemedicine, some concerns remain. I mean, and if you ask me which concerns, well, it is concerns both by the healthcare provider and the patient. From the side of the patient, I think it is still, the gap between the interest. I mentioned that more than 70% of patients got interested into telemedicine solutions during COVID, but only 40% actually use them. So there is still a gap there. So patient education, increasing awareness of the possibility and the opportunities is certainly where we need to pay attention to, lack of awareness. One key thing, I believe, from the patient perspective is and I mean, I'm still believing very much in the patient-doctor or patient-nurse contact when consultations are in place. There is a doubt, and I think the doubt is rightful, whether a telephone or a video conference is as effective as a physical contact between the doctor and the healthcare provider and the patient. And I think this needs to be addressed. I'm honestly not advocating completely replacing the physical contact and the intimate part of the contact between a healthcare provider and a patient by a video solution. I'm not advocating that, but I believe that when the indication is right and when the position and the criteria and the quality criteria for such contacts are in place, then there is certainly a number of indications or a place in a care path for such solutions. I already mentioned the sustainability of the reimbursement also is important for the patients. They need to be sure that what they do, what they are exposed to is going to be reimbursed, and what the costs will be and what the reimbursement will be from the patient side. If you look at it from the physician or the healthcare provider side, there is still some concerns about security, for instance, confidentiality, privacy. What about the GDPR business, the data protection in the European context? How do we position as doctors such telemedicine solutions in our workflow? If we do it right, I think again it should be integrated in our. It should be integrated. Telemedicine solutions should be fully integrated in our workflow, in our normal workflow, and thirdly, just like the patients, I'm sure that many of my colleagues still have doubts about the effectiveness and the full potential of teleconsultation compared to an in-person visit. And again, same is true for what I told you about the patient perspective. What about costs and reimbursement? I mean, that is also a concern on behalf of the doctors. So, despite the fact that COVID has basically shed a light, a very bright light, on the huge opportunities of telemedicine, some of the concerns still remain and need to be addressed, I believe.
Mm-hmm, mm-hmm. And here we can say, I mean, you mentioned a lot of examples in the field of prevention, diagnostics, therapeutics, rehabilitation. It's rapidly progressing. But also in the organization of care, as you rightly mentioned, what more needs to be done? Because obviously you mentioned the integration. So very often when we talk about the care or how to look after people living with a neurological condition, we emphasize the need for, and you just mentioned integration, but also coordination and multidisciplinarity. How do you see that these tools can support this kind of collaborative work around people living with the brain disorders or neurological condition?
Well, it is a matter of integrating this in the diagnostic and treatment paths of neurological patients. That is partially the job of hospitals and healthcare systems and doctors and nurses. That is what we should do. I think we should also educate our young neurologists and trainees in how to actually perform telemedicine solutions. They are for the moment not well trained for that. They are not fully aware of that. So, I mean, the work on the side of the healthcare providers is clear to me. We need to establish criteria. We need to define not only the teleconsultation, but other services that are amenable to telemedicine solutions. We need to define them. We need to give them a place in the diagnostic and therapeutic path of patients. From the patient side, I think we need to make patients more aware of what's going on, what is possible. We also need to manage the expectations of the patients, I think. I mean, you cannot expect, I mean, there are limitations, and these limitations should also be clearly addressed. But I think we should make of this whole telemedicine issue a positive story. I mean, we can make it. It has clearly been shown that it is a positive story. We can make a positive story out of it. It will not only, and if we do it right, it will increase, or it may increase the quality, the intensity of the contacts that we have with patients. It may increase the approval by patients. And it may also solve some of the capacity problems that we have in neurology, with long waiting lists for people ready or willing to see an actual neurologist in an in-person visit. If you look at what the potential of telemedicine solutions are in replacing, in well-selected cases, a hospital admission, I mean that part is vast. I mean, we're talking about hundreds of millions of euros that could be shifted from hospital admissions towards ambulatory services. And I'm not competent of addressing all these financial issues, but I think there is an attractive scenario also from the perspective of the third-party payers or the reimbursement agencies there.
Mm-hmm. Mm-hmm. Yes, very, very clearly. I think, Paul, we are reaching the end of our podcast today, but I would like, before concluding, to leave you the opportunity for a last word or a concluding word.
Well, maybe just
Right.
I'll try to be brief. I think we had a good conversation about what is really fascinating and what is also driving, in part, driving myself as a professional here and a doctor. I think neurology, current neurology, is unthinkable without active innovation. I mean, from an academical perspective, obviously innovation is necessary. It goes without saying that a rapidly evolving clinical field like neurology will be driven by all kinds of innovative solutions. On the other hand, the issues with burden of disease, increasing prevalence, and limitations in accessibility, limitations in workforce, limitations in expenditure will require us to be very innovative in the way we organize neurological care in the future. So innovation is very hot in neurology. And talking about and finalizing my talk with regard to the more concrete point of telemedicine, I honestly believe that the future of telemedicine in neurology is very bright.
Thank you very much, Professor Boon, for your insights. And I think we now are coming to the end of our time here today. And as always, it has been really a fascinating discussion, which I very much enjoyed, and I would like to see continued in our Brain Innovation Days event. It was a pleasure to host you today. There is much potential for good in telemedicine or teleneurology that can only be improved with innovation, hopefully, with positive outcome spurred by this pandemic and the learnings we can take from it. Thank you to our listeners, and stay tuned for more Brain Talks in the near future. And for all the latest and current Brain Innovation Days news, don't forget to follow us on our social media channels and stay tuned. Thank you very much and have a good day.